Ever since I could remember, I loved the fact of as a nurse, I was able to do so many skills to provide great health care for my patients and to eventually help them in their aid in their recovery for their health. One skill that I found very challenging and I was able to master with continuous practice was the insertion of a peripheral intravenous catheter, which we simply call an insertion of an IV. Now, what I first do is make sure that I walk into the room and I identify myself as their nurse and as a healthcare provider here to provide a service. I then make sure that I identify my patient with at least 2 identifiers, which include the name and date of birth of my patient, to allow me to be able to make sure that I'm providing this procedure or this skill for the correct patient. Then what I do is gather all my supplies. Now, the supplies that are needed in an IV is an IV starter kit. Inside the kit it is tape, some gauze, some alcohol to clean the area. You have a tourniquet, and you also have a Tegaderm dressing that is applied over the catheter just to secure its placement. We also have many different types of IVs. We have, based on the color and based on the size of the needle, helps the nurse determine which type of needle we're going to be placing inside the vein. This is actually a 22 and it's blue on the package. You can see that. And inside you will see that the catheter has an actual blue tip. This is a 22. Now, the way we determined which size we're going to be placing on the patient has a lot of factors. For example, a patient that has been on chemo intravenous is going to have very weak veins. It's going to be they're going to have veins that are very hard to find. So you don't want to stick them with a bigger needle, which is a 20, which is pink one, or an 18, which is a green one, which I actually opened, and this is how they look like. This is without the needle. This is what's inserted in the patient. You do not want to stick them with something so big because you run the risk of actually blowing the vein. So you also want to start with something with 22, or you can do a 24. So the rule of thumb, or the way that we know, is the bigger the number, the smaller the needle. The smaller the number, the bigger the needle. And this is the green, and it's 18. So you'll know that if I was to open this blue one and compare it with this green one's going to be bigger. Okay, so we get our IV. We also have an extension set, and that I already pre applied it. I already primed the tubing with this 10 mLs of normal saline. What's kind of cool about the normal saline is that this is the only type of liquid that is compatible with your blood. So it does not matter what type of blood you have or what condition you have. I'm always able to administer this 10 mLs of normal saline. What we normally infuse or we run through these catheters are quick administration of medication. If we want something fast and right now, this is an emergency, we need to administer medication, we always want to have an IV in, or for any blood transfusions. Blood transfusion is typically an 18. We want it bigger. The only reason for that is because blood is thick and it does have the risk of clogging. Those red blood cells do have the risk of sticking together and blocking possibly smaller catheters. So we always want to try to get the biggest one that we can for that. For surgery patients, we always want to have at least a 20 in, just because if there is an emergency in the surgery and this patient is bleeding out, we want a quick resource to be able to infuse blood if necessary. So we will begin by going into the room, having our supplies already ready. We already identified our patient, we washed our hands, and we applied gloves. Now, we apply the tourniquet. The rule of thumb is at least half an inch above the area that you want to stick. You always want to start below or the veins on the lower area of the extremity, because if you find a vein on the higher end of the extremity and you blow it and it's no longer good, anything that you place on the bottom of this extremity is not going to be good, because we're going towards the heart, liquid or circulation towards the heart. So if there's a blockage here and you are putting your vein in and you're running fluids, it's going to get blocked there. So we don't want to start, we always want to start lower. So we're going to first start by getting our alcohol, and this is the way it works. We kind of have to squeeze this together and you'll hear it pop. Get your alcohol, clean the area, and you'll see it you found the area that you want to stick. And actually here you can actually see my vein coming out. And if you feel against it, you can feel it too. Make sure you clean it. Grab your catheter, and I will be opening the one that we have, the blue one. I'll be administering a blue 22. Unlock or uncap it, and you look at the end of the needle. Now you see that on the very end of the needle is an opening of the catheter right there, and that is called the bevel. You always want the bevel to be up. So tourniquet is applied, patient is cleaned. Now you're going to be able to, you're going to tell the patient that you're going to stick them, because if you do not tell the patient, they might get startled, and they might get a little bit hurt, and they might jump up, and you run the risk of sticking yourself. So you do not want that. So you then get the catheter or get the needle, you apply it against the vein, you dip it in, you're telling the patient. And once you see here in the middle that there's blood, you'll see there's blood there. That will let you automatically know that your catheter is in the vein. So you go ahead and advance it as quickly as you possibly can. Advance it, hold it, and you will hear the end of this needle lock. You hear it? That lets you know that the needle is actually secure in here. So it does not let the nurse get stuck. You put that in your sharps. This thing is in. You apply your Tegaderm, which is your dressing over your catheter. So your catheter is here. You apply your dressing. I can't hold it. You apply your dressing. You hold it down there. And then you hook it up.